My name is Rai. My colleagues tell me dementias, particularly of the type of Alzheimer's, are becoming common even in India. I personally have no experience because I have lived almost 50 years in Europe. My question is, what is your experience with minor cognitive impairment, people with minor cognitive impairment who go to either dementia or stay in that stage, specific or non-specific? I mean, I'm not talking of dementia patients because it's a very complicated matter until it becomes clinical. There are years lost. On the whole, people with memory problems, minor cognitive disturbances, what is your experience with meditation or yoga?
Yeah.
Before telling our experiences, there were two studies that I showed. One was that there was increase in cortical thickness. So as we know that in dementias there is cortical atrophy. So if a long-term practice of meditation can increase cortical thickness, then it should have a preventive value in cognitive impairment and dementias. And there were another study dealing with default mode network. So if the meditations can bring the connectivity in default mode network, they can be helpful in dementias. Now, as far as our experience is concerned, we get patients who suffer from mild cognitive impairment and their MMSE scores below 17. And in the yoga therapy hospital, we follow a schedule that starts with Om meditation 5:30 a.m. in the morning. Then they perform one set of asanas. Then after that they take their breakfast. Then doctor assesses them. Then there is 1 hour of pranayama. Then there is another asana session. Then especially for these people, we incorporate lot of chanting, chanting of different mantras, chanting of Om, and indulge them in yogic games or Kriya Yoga. So with these kind of practices and the asanas done with breath awareness, we have observed that in a span of around 12 weeks, people start recollecting things better. In fact, there is a case which we have observed considerable improvement, Desai ji, in a period of 1 year now. So when I met him last year, he was just repeating the sentences which I was telling, but now he is giving much more sensible replies to it. So there is definitely an improvement in his short-term memory, in his executive memory, in a span of 1 year. So integrated approach of yoga therapy, where we include asanas with breath awareness, lot of chanting, and pranayama, performed regularly for 1 year, can bring about a reversal or reduction in progression of MCIs. This is what I feel. Didi, you would like?
Of course, the publications on improving memory in normal children, there are several publications. We have had several PhD students publishing their work on associative memory, recent memory, long-term memory, etc., executive memory, etc., where in normal children, improving memory through these practices has been well documented. To prevent memory, how did our ancient people make it a social practice so that they would not develop dementia is very, very interesting. In fact, 90% of all the learning that used to happen in the earlier days was through rote memorization. Even we as students, children, school children, we had to do a lot of rote memorization. We had to by heart poems, slokas, and lot of memory stimulating things. The entire knowledge base was designed to learn through memory, And that's a wonderful thing which we can bring it back today. And as we see in the present day education, we are finding that the challenge for memorizing, challenge of rote memory is 100% gone. Because people say, why we should waste your time on remembering even tables? There is always the calculator which is available to remember the tables. Why you should remember? So this is probably lack of challenge to the memory maintenance, which will aggravate the memory problems. So looking at the root cause of increasing prevalence of dementia, the training programs, present education system, stress, early aging changes, and more people living up to older age are all the factors which is going to make a very big difference. And so prevention is better than cure is the first step, and then comes normal people improving their memory, then sick people improving their memory, are all demonstrated.
I also would like to add, when you talked about evidence, then you also mentioned about prefrontal cortex and hippocampus. And these structures are vulnerable for any dementia. These are structures to be initially affected even in Alzheimer's case. So probably it could confer protection through prefrontal cortex and hippocampus. Yeah.
I have two questions. One is you have talked about quantum mechanic models for assessment of meditation. Could you please enumerate some of them? First one. And second question, the electrophotonic imaging that we have, is it also a quantum mechanical model?
Yes, definitely. Gas discharge visualization, where on a charged glass electronic plate, a person keeps the finger and the electrons are pulled in, and then it is able to give us the state of microcirculation of the body, which is a very dynamic one, and it changes with every emotion, every thought. So therefore, such kind of devices, we need to do much more research, validate them, and bring. So these are the kind of devices that we need to trap the effects of meditations. Electrophotonic imaging, very correct.
Yeah, actually I would like to contribute to both the questions here. First of all, I would like to thank Dr. Hemant. One of my studies was also quoted here actually. It is about the perceptual speed and executive functioning in the long-term practitioners of meditation. Regarding the first question about minimal cognitive deficits, what we have been talking, I would not go that far saying that it reverses the MCI or it reverses the dementia process as a whole. But in my study, what we have done, it was a multi-center study actually, and we found that long-term practice of meditation, long-term means more than 10 years at least. Now that was associated with people performing better on many of the attention-related tasks. Now here when I talk about attention, there are different, their attention has been classified in many different ways, and there are many different subdomains and many different meanings of the attention that we talk about. What I had tested was the concentrative meditation of Vihangam Yoga. Now we found that concentration and the practice of concentration itself is an important indicator of how much a person is able to recollect the memory. Why? Because in all the, attention is the most basic cognitive function actually. All the other cognitive functions are based on attention at some level, or it involves the usage of attention. For example, task switching is involved in executive functioning. Sustained attention is involved in your sustained attention tasks. The ability to select the attention, that is selective attention, is involved. So concentrative meditations particularly, they have the ability to delay the process of minimal cognitive deficits. If we consider minimal cognitive deficits outside the domain, again, MCI, it has been classified in different ways. And I am also a member of American Association of Alzheimer's Disease. So the way we classify dementia and MCI, it again makes a lot of difference on what we are talking about actually. So nomenclature is one of the important things that we have to understand when we talk about the effects of any XYZ on attention, on dementia. The second thing, the structural aspect of the dementia, when there is a cortical thinning is happening, when there's a loss of neurons, that is the tricky part actually. Does meditation practice reverses the loss of neuron? I would not go that far saying that it is possible, but it definitely delays the loss of neuron. That is what we can tell till now. So it's definitely a preventive thing that we can talk about. Treatable or curable thing, we might not be very sure, but yes, when we go ahead with the deeper aspects of understanding the meditation and as such, then we might find some other ways. And especially concentrative meditations, what Dr. Hemant was talking, there are two different kinds, open-ended focusing and the concentrative or the focused meditation. The focused meditations are very much associated with cognitive functions as such. And because of cognitive functioning, what ma'am was talking ADHD, similarly my implication was in the old age people, where we also found MCI people also. And we found that if we compare two MCI people, one who is doing meditation and one who is not doing meditation, which again could have been biased at many levels, but definitely meditation, it slows the process of cognitive decline over the time. And definitely it helps in preventing the conversion of MCI into a full-fledged dementia. These are the two things that we can. Recently, we have published one article in Neurology India that is called the identifying the pseudo-dementia actually. So depression, cognitive decline, dementia, MCI, they are kind of interrelated at many levels. So that might be, because it helps in depression, that might be another factor by which it might be helping in cognitive decline. Second thing, coming to the quantum aspects actually, I just have a couple of understandings in physics actually, I don't know. But quantum physics in itself is such a, vast area in itself that pinpointing one thing out of it and talking about quantum computing, I think it's a very far dream right now. But yes, quantum mechanical models have been used for many times. There is one major association between the two. We don't understand quantum mechanics, we don't understand consciousness. So we can associate both the things which we do not understand. That has been the major understanding. But there have been several people who have been working overall again and again. So I recently talked with Dr. Stephen Hawking. He said that he's a nihilistic person actually, he does not believe in God. Most of the things that we think as a philosophical, he does not believe. But he has a good understanding of quantum mechanics, that is for sure. Now, quantum computing developing in brain is almost impossible right now. There is no way we can develop. But quantum structural understanding, like your Stuart Hameroff model is there, that collapse of the quantum cognition in the microtubules of the brain. At that level, maybe we can think about that. Other than that, more than quantum, we can more focus on the artificial neural networks actually. Individual artificial neural networks, their connections and how do they function, that is far more feasible than thinking about quantum mechanics, which is much beyond our, in physical world also, quantum mechanics is much beyond our understanding right now. So that is one more contribution I would like to say. Yeah.
Thank you.
Thank you.
Thank you very much for very useful inputs.
What is the right age to initiate the meditation for the kids? I am Ramesh from KVS. What is the right age to initiate meditation for the kids?
Now it has been standardized that we start from the 5th standard. The NCERT has prepared the syllabus which includes asanas, pranayama and meditation. That's the standard one. 10th year we start, but we use for 12 ages. In even smaller children we use that.
I am Dr. Krishnan. I have a question for Dr. Nagarathna. Ma'am, there was a study that conducted which said that rote memory is best given between the age of 8 and 12 as per our ancient practice, where the entire scriptures could be practiced, and that is one of the best age for rote memory to be given. Question number 2 is for Dr. Bhargav. There were some studies carried out on long-term meditators, particularly Tibetan style of Buddhist meditators, where they said the brain network, neural network itself showed a lot of changes. What is your stand on this? Because in your talk, you talked of some alterations, but you didn't talk of a neural network change. But this was scientifically shown where I have seen. What is your opinion on that? Ma'am,
I have no opinion. Thank you for that information. That yeah, answer to the second question. Maybe Dr. Raju himself has the answer.
Sorry, we are just with the last question yet. We haven't finished yet.
Yeah.
With that question. Yeah. Yeah, we have to answer. The neural network part is quite interesting. Are we looking at more number of neurons? Are we looking at more number of synapses? Now we know it looks like we have to go beyond the neurons and synapses. We have to go to the glia, whether it's astrocytes or microglia also can play an important role. I think that imaging with powerful algorithms which are available now to quantitatively analyze, we are moving in the direction, but I don't know whether we have a definite answer yet. But I would say that whatever evidence as far as now available could be easily anecdotal. That's what my opinion. Still, a lot of work needs to be done in this area. What do you?
So there are some studies showing enhanced neuroplasticity with meditations. So with this thing, we can say that the neuronal connectivity is responsible for this enhanced neuroplasticity. So probably that is the reason that even though there may be no objective improvement, but the functional improvement is observed in patients.
See, we still have lots of questions whether enhanced neuronal connectivity would translate into enhanced behavioral performance, or you need less neural connectivity in some people to produce better performance. For example, in schizophrenia, they have more connectivity than what is required.
Thank you.
I need to make a clarification on this memory part of it. Now, I've read the book on I Am That, Nisargadatta Maharaj. And, he had a translator, two translators, and Ramesh Balsekar was one English translator who was constantly translating Nisargadatta's work to all the foreigners. And he has written several books on all that has happened. And basically, I find that when you reach the spiritual, today we are not looking at only intelligence quotient. We are looking at emotional quotient, mental quotient, and spiritual quotient. The reason is because we feel that all of this are aspects of memory. When you really get into awareness and get into the frontal lobe, and you show fMRI studies showing frontal lobe, basically what happens there is the frontal lobe is increased. It doesn't mean that the memory tools that we have for dementia is going to be effective in that, because the tools are created for a different purpose. But in spirituality, when you have awareness, you have two types of memory called as the thinking memory and the working memory. The thinking memory belongs to the past, projects to the future. The working memory is in the now, right now. Because when you read the book on the power of now by Eckhart Tolle and the earth, they are all mistakes whose memory, he says, in terms of my knowledge of PhD in Cambridge, I don't remember anything. But whatever questions you need to ask me, you ask. The answers come to me. So basically, I think in spirituality, in awareness, and in consciousness, we are dealing with memory which are very, very functional, which is needed right now.
Yes.
You can have people working on dementia, Alzheimer's, do meditation who are very, very functional in the moment. And that is what is important. They are not dysfunctional. So we can't be using tools which we have used for Alzheimer's and apply the same tools now. We need to create tools on the functionality, on his quality of life, on his subjective feeling of well-being. I think times have changed. We need to create tools of his functionality on how good and happy he is, how useful he is to the community, and what a difference he has made to life, to himself and others. I think we need to have different tools. Thank you.
Are you suggesting more of a subjective appraisal?
Not only subjective, also objective. What difference has he made? If you talk to the relatives, they say, he is not a burden. Sometimes the caregivers need to be educated. The guilt they have, they feel, I don't know what I've
So
done.
it would be more of a phenomenological evaluation.
Yes, total.
Global evaluation.
Total. It's not just the individual. I think the entire environment need to be educated, need to be spoken about, need to be created with awareness. And if they also go through meditative processes, they will let go. They will accept reality. It is Mandukya Upanishads in real terms. They know what they are. They are not the body, mind, they are the spirit.
Okay, start there.
So exploring organic basis becomes secondary.
In this context, I should, as you raise the question of spirituality, the entire sadhana is deleting all your memories. Is it not? Deleting all your memories. We have so much of deep-seated memories at our subconscious mind, and even CBT people and all of us remove that to help them to remove the old memories which have been troubling them, which they are not aware of, etc. And the entire sadhana is just to go on deleting, chitta shuddhyartham, to clean all your old memories on which you had suppressed them, and it comes to the awareness and you work on it consciously, wakefully, and delete all those old memories and give a totally new perspective of the situation. And this is the other way. So forgetting is more important than remembering.
So you need to reduce your neural connectivity.
New neuroconnectivity for a special purpose, which is needed in the now. Because old knowledge is bad. What is needed now is because the whole world is changing so fast.
So we need to have progressive neural plasticity.
Yes, that's true.
Okay, yeah, I think that's very important. You need to activate the silent synapses when you're listening to, when you're doing meditation.
The concept of mirror neurons is that we need to mirror and change accordingly. All the moment presence is all that you need to know. Knowledge yesterday is waste today. Knowledge tomorrow is unknown.
So you are placing more emphasis on working memory.
That's it.
So instant behavior which is controlled by the working memory. So that is clearly shown by Patricia Rakis that it is the prefrontal cortex which is involved for working memory.
And that is not only working memory, but whatever is needed in the working memory. A
Yeah.
surgeon operates and he knows when he's operating, oh, the renal nerve is...
So he or she needs to analyze present input, past knowledge, integrate and take appropriate action.
And whatever is needed in the present knowledge from the past will automatically come because it's already there in this body.
Yeah, but you need to integrate, no? The current input with stored knowledge.
There's not he integrating. There is an integration that is happening.
So,
There's no individual who is there.
no, your brain does it.
That's right. That is,
Yeah.
it is happening already.
It is a process. It is a process. If that integration does not occur properly, you do not see the world as a movie, continual action. You see the world as slideshow, which the schizophrenic patient does.
That's happening.
Both presentations are very informative, and I have a couple of clarifications. Both of you have expertise in Western medicine as well as yoga and meditation. To make a substantial contribution to the field, especially from the research point of view, is it the way forward that one should have expertise in, have more holistic and more comprehensive view about health and disease, or you are better placed than people who have studied yoga and meditation without Western medicine knowledge?
I think we are at a disadvantage than people who can just move ahead in sadhana and not bother about what the brain does.
Especially regarding the documentation part of it. For example, a lot of work is happening from the neuroimaging point of view. For example, showing the plasticity, increase in the size. There was some discussion about...
it helps in understanding the whole thing and convinces this present day brain, scientific mind to accept that what our sages spoke about is acceptable into even today, no? So all these exercises to understand the brain better. Or probably helps the neuroscientist also to understand something more deeper.
No, especially documenting changes in the neuronal network is much more complex because a lot of neurophysiological processes take place. It's not just structural changes.
It's not like a network
Exactly.
phenomena. To document, it's a lot more difficult.
Thank you.
The other thing is, I have some difficulty in understanding the nomenclature. I consider that even Buddhist meditation is Indian meditation. Indian meditation, it came from the river or from.
I
you can
think
take it from
our
political
friends
point
in the
of view.
afternoon will
Yeah, I
start their talk by saying that.
Thank you.
There is some.
Dharana and Dhyana, what?
There were 2 slides.
Huh?
So what was your basis for categorizing one as dharana and dhyana? What were the factors that you took into for those slides, for those photographs? Some MRI scans you had.
Okay.
So
okay.
how did you determine that?
How did we make them do Dharana and Dhyana in that study?
Yeah.
We had a lot of
Because
discussion.
that's very interesting for me.
Yeah,
I'd
we
like
had a
to
lot of discussion while
Yes.
designing this particular study, Dr. Naveen's PhD project, where how to ensure that a person is doing dharana or is doing dhyana. And Dr. Shirley was very smart in preparing that design. Maybe Hemant can explain that. We had to do a lot of training of our students, first understand they're doing that, and in the design there was continuous input that was coming to in their earphone that now we are doing the dharana, you are going to focus on this, and they were already trained in that, and then they were asked to switch off, again switch on to dhyana instructions. So it was a very, very challenging task to help our students, our practitioners, to switch from dharana to dhyana, ekagrata to dharana to dhyana. It was quite a lot of training that we had to do for them and ensure that they were doing it by their reports after they did that. Was that your question? No, I don't know whether that was your question. It was. Okay, thank you. Yeah, technical part. How did you help people to move from dharana to dhyana to ekagrata? Yeah, the whole instruction CD that was prepared.
They took the session. They projected with closed eyes. They projected an image here. They brought an image. They kept it, held on to it, and there was nothing else. So there were instructions through head.
Yeah, everything was very, very much focused. They were epochs, yeah.
I can send you the whole paper, sir. You just give me.
Yeah, and that will be the last question. Yeah. We can continue the discussion during lunchtime also.
Yeah, actually, just one question, Dr. Hemant. You have done meta-analysis of all the studies of meditation yoga. I just have one doubt, which I have been having from so many years now. Did you come across any study which definitively says that meditation or yogic practices are effective in epilepsy cases? Now, this is the tricky part, actually. Epilepsy is associated with stress, actually. Even it is associated with excitement also. In some cases, it is also associated with fatigue also, actually. So both the open-ended, it is a challenge for both the open-ended kind of meditation as well as focused kind of meditation. Focused meditation, concentrative, it is some cases have been shown to precipitate epilepsy also, actually. So what is your viewpoint, or any studies which are going on in NIMHANS, I would like to know. I have some experiences in Italy when I was there, but in India, I'm not very sure in NIMHANS if it is going on or not. Maybe you can show.
The person who is sitting next to Dr. Satyaprabha has done work on it.
I know, ma'am, actually. But any studies which...
We have published a paper in 2008, Epilepsy in Yoga, and this yoga was designed by Dr. Nagarathna and his team. So we didn't have a focus, we had complete yoga. That means which had a yoga asana, meditation and other thing. So it was not one particular focused meditation, it was not like that. It was asana, dhyana and meditation. And what we found was there was a reduce in the frequency of seizure, and also our main aim was how it was modulating autonomic function. There was a more of autonomic modulation towards the parasympathetic dominance.
Thank you.
I have gone through that study. I have gone through. Only I was interested in whether any specifically we can find in association, so that we can eliminate those parts of meditation in epilepsy patients specifically.
What is your gut feeling?
Sir, according to me, concentrative meditation may cause epilepsy actually. Yeah. But the relaxative parts of the meditation, relaxation-related parts, they may actually help in epilepsy cases, especially where cognitive arousal is associated. Like some cases, during mathematical problem solving also they have epileptic attack. During excitement also they will have. In many cases, during marriage ceremonies, they have attack because of the excitement that they have. So such cases we may try to help in by maybe some parasympathetic dominance kind of meditation.
Yeah, in fact, in our hospital there, the Trataka technique is contraindicated for epilepsy patients.
Yes, right. Trataka is contraindicated.
Yeah, there was one more study using the yoga postures only, and it found that in refractory epilepsy cases also there were better results after performing the postures. But with such focused meditation and this thing, I could not find any study.
Thank you so much for your participation in this discussion session.